Okay, so recall filter groups is something that we get asked about fairly often, and I am really excited about this topic because I think it's an area that Reminder Dental really outdoes a lot of our competition. And so let me show you kind of how it works. So the first thing to know is, what do we know about the patient's recall? All right. So we know specifically what the practice management says the recall due date is. And so it doesn't really matter whether you did a recall 2 weeks ago, unless the practice management software actually reset the date that's in the practice management software, because maybe you actually set it to be in 3 weeks because you're monitoring something, okay? And so we're not looking at past appointments. We're looking specifically at what the date is in the practice management software for when is that recall due. Um, and then the next things is we get a list of your recalls. These are not recalls that are in our system. This is a reflection of what's in your system. And so by default, the Profi and Perio are enabled, but everything else is not by default. So you might have a lot of other various recall schedules, but this is the defaults. Okay, so next thing is, depending on the practice management software that you've got, everybody handles recalls differently. And so, for example, EagleSoft users, they rarely attach procedures to appointments in the future. They wait until the time of the appointment to attach procedures. And that can be a challenge. Dentrix users sometimes use bundle codes where it's one code that then explodes into 3 or 4 codes. That means subgingival scaling, Paradex, and laser, and all these different things. But when they're scheduling the appointment, they just put one code in. And so one of the things that we've seen is some of our competition doesn't know how to handle a bundle code, or they don't know how to handle some of these other issues. And so, like I said, this is an area that I feel like we really shine in. So let me show you Profi. So number one is we can filter it out by any procedure that patient has scheduled in the future. Okay, so let's say we're talking about George. George has an appointment in 3 weeks. His recall due date is next week. Okay, so are we going to send him a reminder? Or let's say his recall was actually due 3 months ago. So should we send him a 3-month reminder when we know he has an appointment in a week or in 3 weeks? It depends. Maybe he's coming in for a bone graft. Maybe he's coming in for implants. Maybe he's coming in for a crown seat. We don't know, right? If you don't, and so the important thing is, how do we identify whether that is a hygiene appointment? And so we've got 3 ways. We're going to do it either by a procedure, the operatory, or the provider. Okay? And so you can set up any combination of that you want to say, if any of our patients have an appointment in this operatory or with this provider or with any of these codes, do not send in the future, then do not send them a reminder to schedule their recalls. So that's the recall filter groups. It's a pretty powerful system, and it has a lot of flexibility. Lets you run your practice the way you want to run it and still control the messages that are going out.